Welcome to this press conference. We are united here to launch officially the European Q Fever Committee and its website. My name is Vincent Daudet. I'm the secretary of the European Q Fever Committee, and I'll go through the outline of our conference today with you. We have a short presentation on the objectives and missions of the committee by our two co-chairs, Professor Raphael Guateo and George Valiakos. I'll make also afterwards a short presentation of all the committee members. Most of them are here with us in Nantes. Then you will have the preliminary results of the Q Fever Perception Survey that was conducted earlier in 2024 on farmers, vets, and human doctors. Then Carla will go through the presentation of the website of the committee. And in the end, we will have a session of question and answers. You can, of course, mention your questions in the dedicated part in the Visio conference if needed. So first, the committee's objectives and missions.
Yeah, thank you, Vincent. Good afternoon, everyone. So, as it is mentioned here on the slide, the main purpose of the committee, of the European Q Fever Committee, is to increase the awareness about Q fever, because we realized on the field that many studies were conducted in different countries, but despite of that, there is still heterogeneity in the way you can suspect, you can diagnose, you can control and manage Q fever. So one of the ideas is to facilitate sharing knowledge based on different media, as we will present afterward. And so our main mission is to contribute to the fight against Q fever in Europe as a first step, as I mentioned, by promoting science-based, harmonized recommendation for diagnosis, control, and prevention. And we really want to be a facilitator. So even in the future, if you have any question, do not hesitate to consider the Q Fever Committee as a center for resource and knowledge. This is really the main goal of the committee. And maybe last but not least, to mention that we do that also because we had a similar experience in France since 2022. We launched the French Q Fever Committee with already some deliverables, and so now the idea is to move from one country to a more European perspective. So.
Thank you, Raphael. For the committee members, we'll start with our two co-chairs. So first, George Valiakos. He's our co-chair specialized in small ruminants. He's a researcher and an associate professor of bacteriology and bacterial diseases in animals at the Faculty of Veterinary Medicine at the University of Thessaly in Greece. His PhD dealt with molecular diagnostics. He is presently involved in 13 national and European research projects. He's the principal investigators in 5 of them. He co-authors over 50 publications in peer-reviewed journals. The first one that dealt with Q fever, its epidemiology, was published in 2016. And since then, his interest into Q fever has only increased. And our co-chair for cattle is Raphael Guateo. You just saw him here. Raphael is professor of bovine medicine at Oneris, that's the vet school in Nantes, in France. And he's also a research professor in epidemiology. And his PhD was already on Q fever in 2003. And the disease has remained among his core activities. His expertise is being solicited by different expertise bodies like the ANSES in France and the EFSA at European level. And he co-authored more than 60 peer-reviewed publications. He is also the head of the French Q Fever Committee, which is an earlier version of what we aim to do here. Then we have with us Alda Natale. Alda is the coordinator of 3 diagnostic laboratories in serology, virology, and diagnostic microbiology for mammals. She works at the Istituto Zooprophylattico Sperimentale of the region of Venice in Italy, and she holds a master's degree and a PhD. She has developed an expertise in monitoring programs diagnostic and research activities, and she has co-authored several scientific publications, among which some deal with Coxiella burnetii, and she has developed diagnostic tools also in this regard. Angel Gomez is here with his team. He brought several students with him. He's presently a principal investigator in the microbiology agents associated with animal reproduction research group at the CEU Cardenal Herrera University of Valencia in Spain. And he focuses on several diseases and alternatives to antibiotic therapy and listeriosis in ruminants. He also has been a patient of Q fever, and so he has a double experience on that part. And in his lab, Q fever is still considered an emerging line of research, but an increasingly important one. The person that is not with us today is, for a good reason and a positive reason, is Slavek Koszminski. He's 120% cattle practitioner. He runs his own practice with 50,000 cattle under his care. His main specialization is reproduction. He's dealing with Q fever and mainly under the subclinical or chronic form in cattle over the last 10 years and have a strong experience in that. But he was not able to join us today. Jonathan Staton is also a practitioner. He's from the UK and he is a registered specialist in cattle health. He's chief executive at Raft Solutions and he's a chair and partner at Bishopton Veterinary Group. But he also is the author of several books, several papers and a large number of communications. He is also a chair of the Animal Health and Welfare Board of England and he is involved in several research programs. Laurent Deloz is our other diagnostic specialist. He has spent 4 years as a cattle practitioner before joining the ARCIA in Belgium. ARCIA is a Belgian non-profit organization that supports farmers in fulfilling their obligations in the needs in terms of animal identification and animal health. He is in charge in ARCIA of the abortion protocol for diagnostic. And he is the manager of the Health Administration Service of ARCIA. He has a 14 years experience in diagnosing Q fever from there. We also have Daniel Sifo Arcos with us. He's the only doctor in human medicine. He's presently a medical intern resident of public health at the Spanish Public Health School at Instituto de Salud Carlos III in Madrid. His master focused on the epidemiology determinants of Q fever in Spain, and he's still working on the subject now. He is part of the Spanish National Center of Epidemiology in Human Q fever Surveillance, and is involved in our work as well. We also have with us Piet Velema. Piet Velema is from the Netherlands. He graduated from the Utrecht University in 1980. And started his career as a large animal practitioner. Then he joined the Royal GD Services. He's registered as a specialist in small ruminant healthcare, and he is also a diplomate of the European College of Small Ruminant Health Management. He has been a member of the Q fever outbreak management team in the years 2007 to 2010, when the very large outbreak hit the Netherlands at the time. But he has published since over 100 papers in scientific journals, given presentations in small ruminants all over the world, and he is still active through his consultancy. His main interest is, as you can understand, crisis management, and Q fever can give you this thrill. And last but not least, we have here with us Thomas Wittek. He is presently professor, head of the Clinical Center for Ruminants and Camels at the Veterinary Faculty of Vienna in Austria. He graduated from the Leipzig University in Germany. Worked as a clinician. He works as a clinician and researcher in Germany, but also in the UK and in the USA. He is a diplomate of the European College of Bovine Health Management. and is a member of the Executive Committee of the World Pediatrics Association, and he co-authors over 180 peer-reviewed papers. And with that, I am the secretary of the whole thing. I'm a vet by training and a consultant in scientific communication, and we go to the preliminary results of the perception survey that was conducted through the European Q Fever Committee to farmers, vets, and general practitioners in Europe. And these are preliminary results because this will make the object of publication in peer-reviewed papers, so we cannot disclose too much of the information in there. And for the farmers' part, I will give the floor to George.
Thank you, Vincent. Good evening. So let me describe you some of the first results of this survey. Regarding the methodology used, the survey targeted farmers from various countries, Germany, France, Spain, Italy, the United Kingdom, the Netherlands, Belgium, and Poland. The total sample size, the total farmers were 905 farmers. We used computer-assisted telephone interview, the methodology, for the methodology, and lasting around 20 to 25 minutes. We had farmers for all basic livestock types, cattle farmers, sheep and goat farmers, and in some cases, some of them had more than one species on the farm. Now, regarding some of the basic results in brief, despite the fact that the farmers use as a source of information their vets and digital channels, which are the expected sources of information, we demonstrate that there is a significant lack of awareness about Q fever. Almost 75% of the farmers are either unaware of the disease or only familiar with its name, with a few exceptions like the Netherlands that had a huge outbreak in the past of the disease, and in France that there is a higher level of awareness, probably due to Raphael's work on this. Regarding the general knowledge, most farmers have some basic knowledge about the disease, that it is transmissible from animals to humans, and that the bacteria can be carried by the wind. But regarding the impact on health performance, the results here were less consensual, as we will see later on. Now, there is a huge lack of awareness regarding the existence of Q fever vaccine, apart from farmers again in these two countries, in France and the Netherlands. And regarding the management of Q fever, most of the farmers declare that they will focus primarily their management strategies on improving hygiene and hygiene of the farm, with low emphasis on vaccination. Even when they have encountered a Q fever case, as a measure to protect humans, farmers prioritize again hygiene, and even they will try treatment using possibly some antibiotics instead of using the available vaccines. Let me report you some numbers. Almost, as I told you, 26% of all the farmers reported to be aware of the disease, and from these, half of them had some personal experience with Q fever, and half of them didn't have any experience. From the ones that didn't have any experience with Q fever, most of them do not report using the vaccine. Almost 95% actually of these farmers report that they do not consider the vaccine as a measure of dealing with a future case. With the ones that they had some personal experience with Q fever, here the situation is better but not good again. 1/3 of them actually vaccinated the animals, but again 2/3 did not vaccinate. And when we ask them about the reasons, they believe, most of them, that the significance of the disease to their herd is not important, is not high enough to consider the use of the vaccination, and that it's not going to help them in this case. So these are from me for the results for the farm survey, and let's continue to the survey.
So exactly the same presentation, but now for vets. So as it was mentioned earlier, it was really the largest study ever. As you can see here, almost 600 vets distributed in the same country, from Germany, France, Spain, Italy, UK, Netherlands, Belgium, and Poland. So exactly the same methodology for interview. Regarding the results, in brief, similarly to what we observe for farmer, digital channel, including social media and professional website, are the source of information they prefer. That's why you will see at the end of the press conference that we already think about delivering on the website all the available information in different formats. We will address that later on. And regarding the awareness and the experience, as it was mentioned earlier, Netherlands and France have maybe a specific situation. The Netherlands, because they had faced a massive outbreak that led everyone to be aware about that disease. And in France, we hope that the effect of the Q fever French committee, maybe other initiative, but at least we have the feeling that it helped to increase the awareness. And in some countries, less than 50% of the vets that do respond to the study had such experience, but cases occur pretty scarce in that case, and some other countries were in between. So maybe a bit less heterogeneous than in farmer, but still lack of awareness and exposure to that disease. And regarding the risk perception and the general knowledge, once again, very diverse response, but as a mean, there is still the need for sensitization about the clinical signs that you can observe in the animal, and especially beyond abortion. Some results also are in favor of more communication about the clinical signs beyond abortion, such as, for instance, infertility and other reproductive disorders. And in terms of diagnosis, maybe due to the available diagnostic methods or regulation in the different countries, sometimes it can lead to misunderstanding exactly which test has to be implemented. So we really feel that there is a need for sensitization and for harmonization. And when we look at the results more in detail, so as it was mentioned for the vets, quite a good level of awareness about that disease. It's part of the curriculum, so it makes sense. But then, depending whether or not they had personal experience on Q fever, the attitude can be a bit different, okay? But when you look at the vaccination, and finally this is in line with what George presented to us some few minutes ago, I would say the penetration or the implementation of vaccination is pretty heterogeneous, okay? So if you faced Q fever in the past, etc., you will for sure more recommend vaccination, but despite of that, there is still a gap between recommendation and implementation of the vaccination, probably for several reasons. Maybe misperception of the real impact of the disease, maybe lack of data regarding the return over investment. This is also the kind of work and information that we can share within the European Committee, because some studies were done in the past on that topic. And so we can observe that for almost 50% of the vet, they do not recommend vaccination or do not even think about the possibility to vaccinate. And because some of them are not aware that the vaccine is available. And as you can see on the top of the slide, the results can be also a bit different depending on the breed or depending on the type of ruminants, if it's cattle, if it's sheep, if it's goats. Probably because in small ruminants, when you have abortion due to Q fever, it's mainly abortion storm, and so maybe the perception of the risk, and so the interest, for instance, of vaccination is maybe well perceived, while in cattle, there is still some work to do to exactly improve, I would say, the awareness once again and the knowledge, about that. So, as you can see, finally, some similar results between vets and between farmers, and maybe more efforts to do that in that way for vets to share all the knowledge that we have about the clinical science, the proper way to make a diagnosis, and then the different options regarding control, including vaccination and hygienic measures. And so we can move to the GP survey.
Thank you, Rafael. Good afternoon, everyone. I'm Daniel Cifo. I'm a member of the EU Q Fever Committee. And I'm going to present you the results of the GP's survey. First, we want to talk about the methodology, quite similar from the other surveys. We have the targets were human doctors that were practicing in a livestock breeding region. We have the same countries as the other surveys. Sample size was 360, and the same data collection method. As you can see, the structure of the survey was similar from every country except for Belgium and the Netherlands, which had each one had 30 participants. For the rest countries were 50 participants. And talking briefly about the results, first, the sources of the information, we identify two main sources. First, the digital channels, and the other one is the peer consultation between colleagues. Q fever awareness is the part where we found more heterogeneity. It is clear that only a minority of human doctors are not aware of the importance of Q fever. And we see that if we look at the countries, normally those countries that have more frequent personal experience treating Q fever patients do have a higher level of awareness. Perceived risk varies also in countries. We have some countries that most countries say the risk is low, but for example, we have higher percentages in high risk perception, for example, in countries such as Spain or France. We didn't find significant variation in the knowledge of Q fever across the countries. They do have a good awareness about the treatment options in humans. And most of human GPs agree that the Q fever is in an underdiagnosed condition in humans. They also agree that they aren't as much informed as they wanted to about Q fever, and they also identify notable gaps in their knowledge about the disease, and also about the Q fever vaccine for animals. Even, for example, in the Netherlands, where the vaccination is mandatory in animals. What about the disease, the Q fever symptoms and people at risk? Awareness of Q fever symptoms is generally high in GPs, in GPs, especially when it comes with the flu-like syndrome. But we have also some other presentations, such as the chronic fatigue syndrome or all the chronic presentations of Q fever that they are less aware about them. When it comes to the people that are at risk of getting infected from Q fever, we see that GPs identify quite good farmers and farm employees, also vets. But for example, when we talk about the people that may live near the farms or in neighborhoods with a high number of animal farms, they do not recognize that risk that much. And about the preventive measures, most of them focus on hygiene measures. We have the highlight that, for example, in French GPs, animal vaccinations is more supported. The most recommended preventive measure, as I said, is the general hygiene measures. They identify the vet as the main actor in the protective measures from Q fever. They also mention, for example, the treatment of the infected animals. And for example, the knowledge about the animal vaccination, we see that it is a bit lower, even in those countries that, for example, have the highest awareness about Q fever. When, for example, the case of Spain, we see just an awareness of the Q fever animal vaccine existence of 4%. Most of human doctors consider that farmers are aware, but we see some heterogeneity also in this part. And also it's important that a significant percentage of doctors didn't feel that they could answer this question with enough information. So this is all everything with a GP survey, and now I'm passing to Carla.
Thank you.
Thank you.
So I continue from here. I think you have seen in the survey that was presented by our three Q fever members that digital channels for veterinarians, for farmers, for human doctors, they are the main source of information. So it was very important for us that we were able to build the right platform that would allow the committee to communicate with vets, with farmers, and with human doctors where they are. So the website that we are launching today, it's now live, was built with that purpose in mind, to be able to be a platform where the committee could communicate, and most importantly, considering all the gaps in terms of knowledge that were identified from the market research, to develop the right tools to address those gaps. One thing which is important and was important for the committee was also that the visual identity would be able to transmit and communicate their mission. So the logo that you are seeing there in the right from the Q fever committee, it actually brings together three connected notions, where each one of those notions, it represents one of the phases of the work done by the committee. You have on one side an abstract graphic of the bacteria that represents the problem, the root cause of the disease, and a problem that the committee wishes to address. On the other side, you have the magnifying lens that represents the research and the focus that the members of the committee are putting into its work and recommendations. And on the other side, you have the sun that basically represents shedding light over a problem that is existing across Europe, and bringing that information to the public, to the veterinarians, to the society, to the farmers, and to the human doctors. So when we put all of this together, you can see the logo, and you can also see that we have different ramifications, and each one of these ramifications represents one species and how they are interconnected, and how the disease at the end needs to be addressed as a One Health problem. In terms of structure, the structure that we wanted was a structure that would allow the website to become a central hub in terms of Q fever knowledge. So you'll see that it's organized into 6 sections. You have a home page which explains why the committee was created. It highlights also the high prevalence, so it brings awareness on the high prevalence. You'll find there a map where you can see the prevalence across species and across the different countries. And it gives also the last updates from the website so that when the vets visit and the farmers or human doctors visit, they can actually see the latest updates. It has a section explaining who are the committee that Vincent already presented with their mission and their CV. Then you have a section with knowledge around Q fever. The tools that you have there is where all the resources and everything that is produced by the committee will be presented, and it's divided into different sections that we'll see a little bit afterwards. And then it was also important to bring together all the publications and articles that are relevant, that are related to Q fever, and that would help the veterinarians, the doctors, and the farmers to have additional information. And then, of course, a section about news that will bring the latest news and latest events related to the disease. Going a little bit more in detail, you already know the members, but here the people that will visit the website will have the opportunity to understand who the committee is, but also what is the mission of the committee, and then understands the different members, their CV, and be able also to look for additional information on their publications, on all the work that they have done. Regarding Q fever, it was very important in this type of channels, digital channels, the information is presented in a clear way, straight to the point. And for this, it's organized in a very intuitive way in 7 key points. All we need to know about Q fever in a way that is easy to read, and it brings the main messages to the audience and to the reader. And one important point, and one of the first resources that are being built by the committee are what we call the Q facts. The market research allow the committee to identify what are the gaps of knowledge, and these Q facts are in a very simple, clear way, straight to the point with clear messages. It's highlighting, or it's, how should I say, it's providing the information that addresses those gaps to make sure that veterinarians, human doctors and farmers, they are well informed about the disease, about the impact of the disease, about how they can suspect it, how they can detect it in their farms, and how they can control it. So these Q facts some of them are already in the website. There will be others uploaded. There's a lot of work being done, and the website will be a living place where this information is being uploaded. And you will find information which is targeting veterinarians, targeting farmers, and also targeting humans. So the website is now live. I think all the committee invites you to visit and to explore the information that is there. So this is all from my side. I think I will pass on.
Yeah, thank you. Thank you, Carla. Nice explanation. The website is live since this afternoon. It contains, at the moment, 2 Q facts. One is when to suspect Q fever in small ruminants. The other one is when to suspect Q fever in cattle. And both of these fact sheets are for vets. The same subjects will be dealt with, being addressed for farmers. And little by little, over the summer, you will see that the resources will grow with other Q facts being placed online. Now, if you have any questions, we will be happy to answer them, either online or in presence.
Well, yeah, I do have some questions. First, will this only be in English or no? I mean, if I'm a Polish farmer and I want some, I mean, obviously don't speak English, so how can I?
Raphaël, tu veux répondre?
Yeah, if you want. I think we had already that discussion, and we know that depending on the audience, we had to translate it into the different languages. So that's why also we have so much diversity in addition to the expertise and to experience, but also to identify the right channels to push the information. And in addition to the fact sheet, we have in mind also to organize some webinars and send, once again, depending on the audience and the topic, either in English with maybe some translation or in the specific language on the specific country.
Which is not very clear to me, in that if I'm a farmer and I'm like wondering, I have some abortions, I don't know, so I will like Google, I have some abortions, and will I get this website, or do I need to know, do I need to suspect Q fever to find this?
I think, Carla, you're best placed to answer that.
Yes. What we have done was also for this website, to work with search engine optimization in order to make sure that the keywords that we know that the farmers, the veterinarians, I'm going in the direction that you are asking, that the keywords that they are looking for, it allows us, the committee, to bring their messages to the top, and that's why you also see that right now you'll see the PDFs, but you'll have a page for each one of the Q facts directly in the website, so that is detected by Google, and it allows the users, and it allows Google to position that. So search engine optimization is obviously one of the tools that is behind it to really make the website a central hub around Q fever.
And if I may add something, I think what we learned from the French experience, it's also important to push the information on the different organizations, farmer organization, livestock institute, vet organization, etc. And they are also a good way to disseminate it and to spread, not the disease, but to spread the information.
Do we have any questions online?
Well, there was a comment comment that it was a great team of people.
Okay,
And,
thank you.
And the question was, how were those members chosen?
Well, it's of course, as Raphael said, it's of course a matter of diversity in the countries represented. Of course, of competence, because the members have to be working or have been working on Q fever, and also if they accepted or not. But in that matter, the presence of the experience of the French committee was of help, because it was easy to show an example of such a multidisciplinary approach, and it was quite convincing for some of.
If I may add, to have this One Health approach and combine both at the same time human medicine or livestock medicine of all the species involved in a One Health, let's say, principle for the issue, for the disease.
And one of the goals also was to add, I would say, a person from practice, from farmer organizations, from academia, and so to have a different perspective also was important from research.
There is another question, which is, will you be present also on social media?
That's the intent, yes. We also relay the resources made by the committee through the social media, and we hope that they will also tag us or our website in the near future. For that, it's a little bit too early, because the website just went live today, so it's a bit early to judge on that. But yes, the intent is there.
I think the first step is to have all the information digitized, the appropriate knowledge to be, and then at the second step to disseminate everything, even through social media, which are really important nowadays.
And there's another question which is linked to that. What are your next plans?
Yeah, well, let us just start. No, the next plans are, we've just had a full day of meeting today with the whole members, and by the way, it was the first in-presence meeting of the committee, although we have seen each other on the Visio for nearly a year now. But it was very nice to meet each other, and we discussed that this morning. And yes, we have next plans. Other Q facts, so fact sheets on Q fever on the different fields, as I mentioned. At the moment, there is none of them is online for farmers, and we will address that very soon. Also for GPs, we have a Q fact that will be ready in the coming weeks. For GPs, thanks to Daniel. And we intend to develop the other outreach activities like webinars and other aspects like that. But it's a bit still in the early stage. So yeah, maybe follow up our website and you will have the information.
And as Vincent mentioned at the beginning regarding the perception survey, we have plenty of data. So we would like also to take the time to publish these results in the best way. So, yeah, probably one of the tasks. Yeah.
If there is no other question, maybe we can close the channel, and thank you for attending. Thank you very much.
Thank you.